Hi, my name is Jeronimo Cardona and welcome to Healthy News. Today we are going to talk about leukemia and how this disease affects the circulatory system. Leukemia is the most common type of cancer in children and is called blood cancer. A leukemia patient has an elevated white blood cells. Normal bone marrow cells are displaced by increasing numbers of the malignant cells, which results in lack of blood platelets and regular white blood cells needed to clot blood and fight infections. But what can cause leukemia? Genetic and environmental factors like radiation, infections, chemical exposure, previous chemotherapy, genetic conditions, race, and smoking. But what are the symptoms of leukemia? Okay, we spoke with Dr. Maria del Mar Gonzalez, and this is what she told us. Go ahead, Maria del Mar.
Thank you, Harold. Now, these are the leukemia symptoms. It's fever, nausea, fatigue, skin rash, and nosebleeds. These are the normal bloods that is composed by red blood cells. But here is when you have leukemia, and here you can watch the white blood cells.
Thank you, doctor. But we have another question. How leukemia can affect the circulatory system?
Thanks, Harold. Now, how can this disease affect the circulatory system? Leukemia is a type of cancer that affects body blood forming cells in the bone marrow and lymphatic system. It can take one of several forms and spread at different rates. But most of the time, leukemia disrupts the production of healthy white blood cells that are designed to multiply, fight infections, and die off. In a person with leukemia, these cells are reproduced abnormally and collect in the bloodstream, eventually carting out healthy cells and causing symptoms. Now here you can see the leukemia in the circulatory system. Thanks for our notice, sir. Bye!
And how the treatment of leukemia? Dr. Daniel Correa told us the treatment. Daniel Correa, go ahead.
Thank you, Jeronimo. Leukemia symptoms are vague and not specific. You may overlook early leukemia symptoms because they may resemble symptoms of the flu. Sometimes leukemia is discovered during blood tests for other conditions. Treatment for your leukemia depends on many factors. Your doctor determines your leukemia treatment options based on your age and overall health. The type of leukemia you have and whether it has spread to other parts of your body, including the central nervous system.
And how the treatment of leukemia? Dr. Daniel Correa told us the treatment. Daniel Correa, go ahead.
Common treatments used to fight leukemia include chemotherapy. Chemotherapy is the major form of treatment for leukemia. The drug treatment uses chemicals to kill leukemia cells. Depending on the type of leukemia you have, you may receive a single drug or a combination of drugs. This drug may come in a pill form or they may be injected directly into a vein. Prior to a bone marrow transplant, you receive very high doses of chemotherapy or radiation therapy to destroy your leukemia-producing bone marrow. Then you receive an infusion of blood-forming stem cells that help rebuild your bone marrow. You may receive stem cells from a donor, or you may be able to use your own stem cells. Hey guys, leukemia is curable if detected early. Don't be sad.
And this is all of leukemia in Healthy News. Bye bye. See you tomorrow.